Welcome back to our series where we're discussing the KLAS questions and KLAS customer experience framework. I'm here with Jen to talk about product right
Hello.
now. This is probably the biggest category in that it has the most questions. This is kind of an interesting one because the way we define product, there are the pieces that are related to the software experience, integration, overall product quality, functionality, delivery of new technology. But when we rate a services engagement, the product is oftentimes the consultants themselves and their expertise. So in addition to those questions that we ask for software, for services, we ask about the strategic ability of the firm and the consultants, as well as the overall quality of the staff or consultants involved in that engagement.
Yeah. The overall experience.
Yes.
Yes.
So I don't know how people at a firm feel about being called a product or not, but that is how we've decided to categorize them. So why don't we start with the software questions first and then go from there. So this first one is a really big one.
It is.
Supports integration goals, obviously very critical to the success of a health system, the extent to which that the EHR and other solutions can speak to each other. And this is a question that we get a lot of questions about because the definition of interoperability and integration can seem a little fuzzy. Even with interoperability, there's interoperability, intraoperability, and so it can be sometimes hard to know when we ask this question what it is a provider's rating. So the way that we think about this is we don't want it to be too narrow because we want it to be applicable to lots of different software solutions and lots of connections that could potentially take place within the IT ecosystem. So we just really look at this question and say, how well can a system get or provide access to needed information? So can things that need to be in point A go to point B effectively? And that's really what we think about with that question.
Yes. And the way that we clarify on this, when we do questions with providers and with payers and employers, we have the standard questions that we ask, and we also have standard definitions so that when people have questions, they're getting the same response every time.
Yes. One of the things we do whenever possible is when we do get a rating there, especially if it's really positive or very, very low, we want to understand what specific systems do you have in mind. Is this a payer feed? Is this a connection to the EMR, data analytics, and try to pull some of that out of the conversation? And we also try to understand the extent to which it may be just a challenge that exists in the market, or whether or not that challenge that a provider is describing to us is less about the technical capabilities and the fact that they need to get two software companies to work together, and that poses a number of challenges, especially one of the things that we hear both from vendors we work with and providers is for systems that are not always seen as the most critical or core, getting the funding and buy-in and time and attention to keep those upgrades for those interfaces up to date could be something that's a little bit difficult to do. So in some of the ancillary spaces, that's one of the challenges, aside from the technical piece, just getting the resources within your own organization and getting the vendors to talk to each other and work effectively there.
I know that one question we also delve deeper into is when there are concerns about integration goals and interoperability, being able to understand, is this an issue with the vendor? Are there limitations with the provider or the payer? If they're saying, I'm having trouble, okay, what? We do the deeper questions. And sometimes they identify, this isn't on the vendor. We have our own limitations as an organization. And so we try and glean that as well, because interoperability isn't easy, and getting the deeper story on why something is working or isn't is important.
That's probably the most common question I get from friends who don't work in healthcare IT is, why can't I just take my medical records from here to here? And I think, how much time do you have to talk about the challenges?
Sweet summer child, have a seat. We're going to talk about this.
Yes. So this is going to be a fun one. We're watching this question very carefully and closely, as we always have, because it is so important, but with data blocking regulations and some of the pieces that come along with 21st Century Cures Act. Yes. So this question has always been fairly important. It continues to increase in its importance. What we have found is that when a solution is good at integration, or the perception of the provider is that they're having a good integration experience, there is a statistically significant difference in sales and retention for customer bases of vendors who do well in this area.
That's right.
One thing I will say before we move to the next question, because of those challenges, especially when it comes to, I think one of the most common things I hear about as a challenge is marrying clinical and payer data, for example. Yes. And in some cases we see vendors that have the exact same technical capabilities, similar providers that they're selling to and working with, similar payer mixes, but radically different experiences here. And one of the things that I often see in the data outside of the technical aspects, the provider's limitations, the willingness of the vendors to talk to each other, is really just the expectations that are set around this. So some solutions are developed from the ground up to be part of a native platform, while others are required. And oftentimes we hear when a company that is traditionally chosen to develop does acquire a solution to try to fold it into their portfolio, the providers have an expectation of interface and integration capability that actually is really not possible immediately post-acquisition, because they're comparing it to the experiences they have with the rest of the fully integrated, natively developed portfolio.
Yeah. As a client success manager, some of the most hard constructive feedback I've gotten when it comes to integration is that there's not been a transparent process in sales. Mm-hmm. Often providers will be saying, a vendor says they integrate with everyone. That doesn't reflect reality. And so if there's not a clear process in sales to help a vendor say, this is who we integrate with, this is what type of integration we do. Mm-hmm. If there are providers that think they're getting one thing and then integration doesn't work the way they think, that when you talk about it being an indicator of future sales, mm-hmm. That hurts and it stays a long time. So that's something I'm always looking for.
Yes, we hear that a lot in the comments when we hear about integration challenges. And that question impacts the next one we want to talk about, which is the overall product quality. Yep. There's a lot of questions within the product bucket that are obviously, this is overall, so it's reflective of all of those things. But integration plays a very, very key role in that. One Absolutely. Of the things that I hear when looking at overall product quality is, we're looking at how stable it is. Is it reliable? Does it generally work and do what it needs to do overall? But where we sometimes hear an interesting relationship between this and integration is if a provider was sold a solution based on certain outcomes and levels of achievement mm-hmm. That they hope to pursue that require certain integrations. And if those are not effective or they were not sold as part of the package and now are an add-on that a provider may or may not have in their budget, the quality of the product can be perceived as lower because it is not actually producing some of the expected results. So the product quality, the two things I always think about when I'm on calls with providers and trying to understand low ratings there or high ratings is, to what extent is this about reliability and stability, and to what extent is this actually about one of the other questions? And often if it is about another question, integration is one that comes up quite a lot.
Again, with the sales process is, did they see something that was in beta mm-hmm. versus something that's fully baked? You don't want to buy something thinking it's fully ready to go and then find out you're in the beginning stages of beta or maybe in an alpha project. That's not a surprise anyone wants to run into.
No, absolutely not. Especially when that functionality that you may have been shown is what originally drew you to the product or why you selected one vendor over the other. That's where the functionality question becomes really important. Does the solution have needed functionality? Yep. So as it exists today, regardless of what might be coming in the future, does the system offer everything a provider needs in order to achieve their goals and expected outcomes based on what they set forth as the reasons to buy in the first place? So this question is interpreted a little bit differently by different types of providers, depending on their complexity, how much risk they've taken on, what types of outcomes they're trying to achieve. And organizations are usually pretty good of understanding we have very, very complex or unique needs versus smaller organizations that might not have as complex of needs. And so we do see sometimes differences between performance in large versus small settings, but it's usually because a very, very complex, robust system with lots of functionality is something that a small organization can't support, or there just isn't enough functionality for a large client to do what they need to do. So some of the differences between those sizing are less to do with, well, they have more money, they bought all the functionality, and so we're going to pay attention to them as a vendor, which is one of the things that I know that some folks have asked me about is this because they pay more, they get the functionality and are having a bit better experience?
Exactly.
We find that it could go the other way. You could be a large or a small client and have a bad experience here depending on expectations that were set and the extent to which you're actually able to make use of what you saw in that demo, to your point earlier.
Yes. Beginnings are such a delicate time, and making sure there's that transparency over and over again. Make sure that there is a really good pipeline of complete transparency with sales, with implementation, and then with account management. If you don't, that's going to come back and bite you.
Yes, it's a consistent theme across all of this is the connection,
really is.
with the alignment within the organization.
Communication, it's a good thing. Yeah.
One other thing I want to mention about the functionality piece regarding new markets. One of the things that we see is when there is a new emerging piece of technology, or perhaps a technology that's been around for a while but is suddenly being leveraged at scale or in a more strategic way than ever before. You could think, vendor neutral archive and imaging is a great example. They're not new, but really being used as more than just disaster recovery. That hasn't always been the case. So what we oftentimes find is in those new emerging markets, we'll have that initial group of customers that's leveraging something. They'll have really great functionality scores. And part of that is because there's a new solution that is providing functionality and capabilities that previously just weren't available in the industry.
Wasn't there, yeah.
So there's a halo effect there where, wow, this is so much better than what I was doing on paper. And then as time goes on, if the development doesn't keep pace, then sometimes those scores come down. So I always caution vendors that have small client bases that are growing rapidly to be very, very careful with that question and not to look at a high rating and think, this is our differentiator. We're doing really well. We're the best at this, and also look at the qualitative data to get to the real heart of the issue for providers, which is what is the problem that we're trying to solve, and look for instances where the problem is not being solved, because that is likely indicative of a very optimistic, happy customer base that will not remain so because the functionality, while better than what they had, isn't actually helping solve the entirety of the problem yet.
Agreed.
Building on that, we have our delivery of new technology questions.
This is one of my favorites.
One of my favorite as well.
You see what's coming up.
So, product has needed functionality as it exists today. Delivery of new technology, the full way we ask that question is we ask about the delivery of new technology that meets your needs. So it's not a pure innovation question. Innovations for innovation's sake won't get a vendor good scores here. It's really about the trust a provider has that what you say you are developing is going to be delivered in a meaningful amount of time. We're not going to be waiting 10 years for it. Yeah. It can also mean that what you do deliver is going to be bug-free and usable right out of the gate without a huge investment of IT or training resources. Providers also think back to their past experiences as well in this question. So this is one that kind of transcends time in some ways, where they're thinking back through past releases. Okay, were there meaningful upgrades and changes to the the product over time? And based on my experiences there, what do I think is going to happen in the future? So they're balancing what they know from their experience with what they understand about the roadmap and the future. So there's both of those pieces that tie into that. And one of the things we have seen in a couple of cases is vendors who, by their own admission sometimes, are not the best innovators in the world. They don't release a lot of new functionality, but the roadmap they do have, those couple of tweaks are so meaningful to the provider organization's experience, and they are going to be bug-free and they're going to be released when they're supposed to be released, that they oftentimes get this boost in that area, even if they're not churning out the most cutting-edge, innovative technology.
Agreed. It's really not about the quantity. It's about the quality. And when we see high scores here, what that tells us is that this vendor has their finger on the pulse of what's going on. Are they asking and finding out what their customers need and want, or what they think they need and want?
Yes. So you could almost take this question from the product pillar, take keeps all promises, one of those yes or no in the culture pillar, and proactive service. And if you kind of put those three metrics together, what you really get is really a sort of a hybrid pillar of, is this a vendor that is trusted?
Yes.
Going forward, how much optimism should somebody have? So looking at each of these individually is great, but when you take those three things together, it says a lot about the belief in your vision and the trust that that vision will be delivered.
And the expertise. Do they understand this market well enough to proactively anticipate what people are going to need.
I love that point. That's one we hear a lot about in a space like population health, where one of the differentiators in the buying cycle and for customers that are live with solutions is new technology paired with good expertise and understanding of value-based contracts to help supplement the provider's technology stack and any internal knowledge gaps they have.
Yep. That's what I see in patient engagement as well. That's what's differentiating. Can you be proactive and anticipate what the customers need versus what you think they might like?
Yes. And even if you develop it, can you deliver it? I think that's the word that oftentimes gets overlooked is we say, this is the development question. Well, it's the delivery of a development. Yep. So there is an element of this that also is the training and the implementation of upgrades as well. So we've seen, there's one vendor that comes to mind who sort of has a history of anytime there's a new release, we see a precipitous drop in the scores, and then they start to come back up again. And then they go back down. And if you look at what the providers talk about along that timeline, it's anytime there's a new release, we know the functionality when we get it to work is going to be excellent, but we don't know how to get it to work, and teaching us how to use it and all of our other staff members so that they are leveraging that as a process.
Absolutely.
So the delivery piece there, in addition to the innovation, equals trust and belief in the vision. That's it for the software questions. So the two services questions here, the first one, strategic ability. I think this is maybe one of my personal favorite questions. Strategic ability is really about the general knowledge level of a service or consulting firm beyond what the provider already knows. And this is an internal terms we use at KLAS that I know we throw these around all the time, but the service firms and providers we work with don't always use the same definitions. Is of all the services that we rate, we use terms like white collar and blue collar to differentiate, where blue collar is more about outsourcing, body shop, still expertise in a lot of cases, but there are a lot of task-based things that are being completed versus some of the white-collar consulting engagements that we see where they might be advising on a mergers and acquisition strategy or an ACO or value-based care strategy. Exactly. And they're putting together plans, not necessarily implementing or doing anything for the provider. And one of the pieces of feedback we get from some of the vendors that provide some of those outsourcing pieces is this question doesn't apply to us because we're just outsourcing this piece of the revenue, which fair question to ask. But if you look at the top performers in those spaces, it's not just that they do well with strategic ability. The best performers in those market segments, this is one of their strengths that is relative to the other questions, often one of the highest rated, and is very correlated compared to the other questions with overall satisfaction. So when you do this and do this well, this becomes the catalyst to an absolutely phenomenal experience. And there's lots of different ways, without being a consulting firm per se, to get really good scores and experiences there.
That's right.
So one of the things I think about is how well are you managing the knowledge transfer to the client? So for example, if we were looking at a space like ambulatory revenue cycle management. So you've got your Greenways, your eClinical works that provide a lot of those pieces. How well those vendors and firms can provide transparency into what's happening and why there might be denials, as well as suggestions and advice in order to drive improvement and get better outcomes. That's a great example of strategic ability. Another example that I've seen is a vendor who is in a fairly tactical space. It's a critical space, but isn't really thought of as being that strategic. And they do such a good job of educating their customers who they're doing the outsourced work for on market trends and what that's going to mean for them, that's the strategic ability that is being measured. So there's lots of different ways to really give providers value there, even if you are not going straight to the C-suite or the board to do more traditional types of advisory and consulting.
I think one thing with strategic ability is how well does the vendor translate the language? They have different audiences, right? You've got a C-suite, you've got IT, you may have accounting, depending on what you're using. How well do you translate the language and I can speak C-level well, I can speak accounting well, so that all of these disparate groups know what's going on and are able to take advantage of the intellect and the experiences going on. I've seen interviews where the IT team they spoke the language of IT well, but the language of accounting they didn't speak, and there was a horrible experience. For me, that's strategic ability as well.
Yes, I would absolutely agree. Even something as simple as just the executive presence that you have when working with those staff members, even within narrow areas of expertise. That
Can you de-silo? Can you bring people in and talk about these very sometimes complex projects in a way that multiple departments and teams understand and support?
Now, we talked in another video about the yes or no question we ask in services of, did this firm consistently exceed your expectations? And that is probably the area where we see the most differentiation in terms of provider response there, or client response. And one of the things that I have found in my own analysis is, if you do well at strategic ability, and it is something that is relatively a strength and is strongly correlated with overall satisfaction, you're about 3 times more likely to have somebody say yes to that question, because this is something that allows you to get in and push in lots of different ways to exceed the expectation. So this is a key. If you're somebody struggling with that, trying to figure out how can we possibly exceed all the expectations, focusing here on that knowledge transfer and being able to speak multiple languages, to your point, is a really great place to start. Now, all of that, of course, is built on a foundation of quality staff and consultants.
Absolutely.
It's hard to have great strategic ability if you have people that are struggling. And I know in our current context that's something that providers are facing internally with turnover in their own organizations, but the services firms that they're turning to make up for those staffing gaps are also being faced with this. So this is probably one of the most important questions we're asking, at least at this particular point in time, because we have seen in the recent months some historically strong performers actually have some sour experiences with some of their customers because they just didn't have enough staff to meet the needs. Their bench wasn't deep enough if there needed to be any staff switches. And that's, we'd love to get rid of those in consulting engagements and other types of outsourcing work, but that isn't always possible. So if you don't have somebody to switch with, that can cause problems down the line.
Yeah, there's palpable pain in the Great Resignation, and we're seeing it. One thing that I thought was interesting, sometimes people worry about someone not being a good fit. What do you do? Do you keep them in there and hope it gets better? I've done some research myself where one thing that providers and employers really appreciated is maybe there wasn't a good fit with a staff or consultant. It wasn't a culture fit. Maybe the skill set wasn't there. Vendors that identified this early, addressed it quickly, and acknowledged it and moved on and found the right person did so much better. Even though there was a hiccup, them being proactive about it, addressing it and fixing it, made for a better end story.
This is reminding me of this is something that I saw in one particular service firm's data in 2019, comparing them to their peers. And one of the things that came up, and about equal mentions in their data and competitors' data, was the need for staff switches. But there was a pain for one of those companies, but not for the other. And one of the things we heard from the company that was not seemingly affected satisfaction-wise because of this was how strong the project management was from their own internal team. And that person was in a position to identify some of that before the provider said, we've got to make a change here. So having really great methodology and project management ends up being very critical to addressing this problem. It's at least what we see in the data there.
Not being humble enough and not afraid to say, this isn't working, we're going to be proactive about this and we're going to make changes, rather than having your customer come to you and say, this isn't working, you need to make changes.
So that's all for the product bucket. That's I think the most questions that fall into this one, which I guess given just how much of healthcare IT is IT and product, it makes a lot of sense. Some pretty important ones there. So hopefully that answers some questions and gave some suggestions for those that may be looking to improve on ways to think about these questions and listen differently to their customers, or read and interpret some of the commentary that we gather through a new lens.
Sounds great.